The next bill on our agenda is House File 894. Representative Bernardi is here, I hope, to present that bill. There she is. Welcome. And since she's not on our committee, the chair will move that House File 894 be laid over for possible inclusion in our finance bill. So, Representative Bernardi, please tell us about your bill.
Well, thank you, Madam Chair and members, for this opportunity to present my this bill today. I don't think it was my bill. I think it is a bill for Minnesotans and the people who need it most. People with a chronic disease do better with treatment than without. I think we all can agree with that. Legislating restrictions on medical care actually seems immoral, especially when people who experience being overweight and obese affects 2/3 of us, and especially affects people in Black, Indigenous, and people of color communities disproportionately. This effort or bill is to get rid of legislation discrimination. The accumulation of excess fat mass leads to a myriad of physical, metabolic, and psychological changes. It takes away the health of individuals. There is now universal agreement that obesity is a chronic disease and that it should be treated like any other chronic disease. As in the case with diabetes, hypertension, AIDS, heart failure, epilepsy, multiple sclerosis, and other lifelong diseases, obesity can be managed, treated, or controlled. Medication, excuse me, 1 second here. In addition to its serious health consequences, obesity has economic costs that affect all of us. The estimated annual health costs of obesity-related illness has been projected as much as $190 billion, or nearly 20% of medical spending in the US. The cost of the state of Minnesota for all obesity-related medical complication includes costs for diabetes, with all of its complications, hypertension, high cholesterol, vascular disease, coronary artery disease, sleep apnea, many cancers, degenerative arthritis, including joint replacements, stroke, infertility, and many others. Weight loss reduces lifetime healthcare costs. It makes both scientific sense and fiscal sense for Minnesota to mainstream the treatment of obesity. Medications for weight loss must be an option for every patient who are overweight or obese. There are medications that are approved by the Food and Drug Administration to treat overweight or obesity for the long term. The treatment of patients who are overweight and obese is the foundation of treatment is eating healthy, behavior modifications to develop a healthier, more active lifestyle. It's a focus different than diet and exercise. Medications help patients achieve treatment goals. The benchmark for treatment of overweight or obesity, I'm told by medical doctors, is to achieve and maintain at least a 5 to 10% weight loss from baseline. The weight loss has demonstrable improvements in physical, metabolic, and psychological health. Medication plays a major role in helping to maintain the lost weight and allowing for further weight loss. Modifying the statute that I bring before you today is a very important step in helping Minnesota in the current treatment of obesity and overweight problems. It will allow many patients access to needed health care and update Minnesota law, which will have positive impact for all of us. With us today, I have Dr. Claudia K. Fox. She is an associate professor in the Department of Pediatrics and co-director of the Center for Pediatric Obesity Medicine at the University of Minnesota. She leads the Pediatric Weight Management Clinic, is the co-director of the Teen Weight Loss Surgery Clinic at the University of Minnesota. Dr. Fox has been working exclusively with weight management patients for the past 14 years and is a board certified by the American Board of Obesity Medicine. In addition to pediatrics, her expertise is in the clinical management of youth and severe obesity in this population. Dr. Fox's research focus has also been on the use of medications for obesity in youth. She has been a co-investigator or principal investigator of several National Institute of Health clinical trials examining medications for the management of obesity in youth. Thank you for being with us today. And Madam Chair, if she could testify, I would appreciate
Absolutely.
that.
Thank you, Representative Bernardi. And just before Dr. Fox begins her testimony, I just want to make sure members understand that obesity drugs, and please correct me if I'm wrong, Representative Bernardi, obesity drugs have been specifically excluded from being covered under Medicaid. And that is the reason why we have to have this bill, because it's important to bring them back under coverage. So Dr. Fox, welcome. Thank you for being here.
Great. Thank you very much. Thank you, Madam Chair. Thank you, legislators, for your time. I appreciate it. To start, I want to talk about what obesity is and what obesity is not. Obesity is a complex disorder of energy regulation. It's a disease that stems from abnormal biology that is primarily inherited. Obesity is not a problem of willpower. It is not related to poor parenting or laziness. Obesity is no one's fault. It's a disease that needs treatment. And in Minnesota, nearly 1 out of every 10 children and 1 out of every 3 adults suffers from obesity, and its consequences are tremendous. I want to tell you about one of my patients. I'll call him Derek. It's not his real name. I saw him last week for the first time, and he's 14 years old and weighs 270 pounds. And he came to clinic with his dad, who also carries extra weight. And his dad tells me that he really wants a better life for his son because the dad knows very well how hard it is to grow up being the biggest kid in class and always being sort of the butt of jokes. Unfortunately, Dad's a little bit too late because Derek's already been ostracized for years. He's now in 9th grade from his peers, and he suffers from depression and anxiety. And so at that first visit, as part of our workup, we check blood tests, and lo and behold, we identify that he was diagnosed with diabetes. So now we have this 14-year-old boy, a 9th grader, with depression and anxiety, who now has diabetes and is going to need to give himself insulin injections, all because he was born into a family with the disease of obesity. Because he's so young and has diabetes at this age, it's very likely that he's going to end up needing dialysis in about 10 years when he's in his 20s, and is probably going to die an early death related to heart disease. Now, when I saw him, I would have liked to start him on weight loss medications to help him lose weight. But because he has the Medicaid state plan, these medications were not even an option for him. So instead, we talked about how we could use non-FDA approved medicines and split pills and try to do all these other strategies to kind of get around the fact that he is on the Medicaid plan. None of this is really going to make a difference. If Derek had private insurance, however, the outlook would have been very different. I would have been able to prescribe weight loss medications. He would have been able to lose some weight, which will directly improve his depression, anxiety, and most certainly his diabetes status. It's not clear why Medicaid should call out obesity as being a disease that doesn't merit the standard of care treatment by not covering medications for weight loss. To me, the only logical reason is that obesity is not viewed as a disease or a medical condition. After all, we would never accept the same differential treatments for other diseases like cancer. So for example, if you had a patient with cancer We would never accept that they would have subpar or substandard treatment for if he had Medicaid coverage compared to private insurance. So to me, covering weight loss medications by state Medicaid is really, it's a parity issue. And additionally, we know that obesity does disproportionately affect communities of color, and these are the people who rely on Medicaid. So it's also an equity issue. Now, I am fully aware that covering these medications will cost the state money. However, the cost of not covering these medicines is going to cost the state even more money. The healthcare cost of an adult with obesity is 150% greater than that of an adult without obesity. And these costs stem directly from caring for these obesity-related consequences: diabetes, heart failure, and cancer. So medical assistance coverage of weight loss medication makes good financial sense. It's also the right thing to do in terms of parity and equity and improving the lives of thousands of Minnesotans who are affected by the disease of obesity. And thank you very kindly for your time. I'm happy to answer questions.
Thank you so much, Dr. Fox. That's really, really helpful. I wonder, could you just take a moment to tell us about the efficacy of these drugs? I know that they've improved greatly over recent years, and I think there was just one. There was a big study that with some real success. Could you just address that really briefly?
Right, I can for sure. So what's important to recognize is that weight loss doesn't have to be very much to have significant health consequences. So as little as 5% weight loss can result in substantial decline in cardiovascular disease risk and diabetes risk. So we're not talking about big changes. Most of the medications that are available that are FDA approved for obesity can achieve anywhere from 4 now down out to like 18% weight loss, depending on the medication. So yes, you're right. There is a new medicine that was just FDA approved, or a new study that came out that showed that this efficacy is in the teens in % of weight loss. That one's not yet FDA approved, but it's coming soon. So it really serves as an adjunct to lifestyle therapy. It's not a substitution for lifestyle therapy. It helps people adhere to their healthy diets better by addressing some of that underlying biology that makes people feel abnormally hungry when they shouldn't be feeling so hungry, for example.
Great. Well, thank you so much for your testimony. Are there questions for members? Representative Bonner.
Well, thank you, Madam Chair, and to Representative Bernardi for bringing this forward. And actually, I had a couple questions, and I think Dr. Fox actually answered one, and Chair Liebling actually asked the other. So I'll just briefly comment and say, I think I've long been a proponent of preventative medicine, and I think not only is it the right thing to do, but it certainly has the power to ensure that we have better health outcomes for patients and really bring down costs for the state, but more importantly for the family, and it's just the right thing to do to make sure people are healthier, that they have a better quality of life. So I really appreciate you bringing the bill forward. And with that, since my questions were already answered, I will be done, but thank you.
Right. Thank you, Representative Bonner. And and just for members, a little history. We had this in our omnibus bill last in 2019, but we were unable to fund it in the final bill. We don't have a fiscal note this time, but, and unfortunately our fiscal notes, as you all know, don't capture savings that are, but once in a while we do get there if the savings are so well known and well described. And I'm just hoping that we can fund the bill this year, and also that, and I know I kind of cued Dr. Fox and Representative Bernardi about this question, but kind of how, as time goes on, how we can really show the impact if there would be, maybe the U is doing research, or maybe we don't even need to, maybe it's already there, to really be able to show the economic savings, because in our budgeting process, that's always a difficult issue. Dr. Fox?
Well, there certainly are studies that look at the cost of obesity on a national level. I don't know of any work that can show the cost on a state level, but it's certainly something that we could look at our School of Public Health to perhaps get us some hard numbers, which may help make the case. Okay.
Well, that's great. And Representative Bernardi?
I wanted to add to that as well. I think an important part to mention is that a metric that would really, really be important is that people with obesity will go from 0% of getting coverage for their obesity medications to more than 50% gaining access to FDA-approved medication for their chronic disease.
Yeah, no, that's
huge.
Great. It's huge, yeah. And so I really appreciate both of you. Dr. Fox, thank you so much for bringing your expertise to us today, and Representative Bernardi. And, it'd be great if we could get our fiscal note people to include the savings, so that because then I think we'd see a savings in our spreadsheet. But anyway, we're going to do our very best to start covering this, because it does seem like, there's just, other than the dollars, I don't know why we wouldn't do it. So thank you very much. So with that,
thank you.
House File 894 is laid over for possible inclusion in the finance bill.